What we are describing today is a specific topic that is related to the METIS project, that in general is dealing with issues and training you about AI, virtual tools, and virtual reality. My job today would be to, let's say, tailor the discussion to human anatomy, which is a subject that is taught in medical schools that in the last few years encountered some amelioration/changes thanks to new technologies. I will bring you the expertise of University of Milano-Bicocca, the university where I work at, since we encountered some changes on how we teach human anatomy in the last few years, and we will see what could be done in this regard. First of all, I think that the easiest way to start this conversation is to give you an idea of what human anatomy is. I know that attendees of this lecture are from different fields, psychology, medicine. Therefore, I will briefly discuss some very simple information about human anatomy. I think the easiest way to talk about something is understand what the topic is about, after all. So human anatomy is this specific subject that dwells into the structure, the shapes, the part of the human body, how it is organized in terms of organs and systems. This is a very important topic for all healthcare professionals because it is the basis for our clinical practice. Therefore, a deep knowledge so robust that stays with us for the entire career is pivotal. Since the subject is describing the human body, the parts of this three-dimensional object, of course, this section might come to your mind as a possible tool to perfectly master this subject. This is, of course, an option because with real dissection, with cadavers, you can actually feel, see, understand where the different parts are. And moreover, while you perform the dissection yourself, you might start training your hands in the clinical procedures. But is this approach always feasible? The answer might be not. Sometimes these sections are a little bit limited in access. There might be a shortage of bodies. There might be an issue with the facility because there are rules, regulation in place to have a specific lab to be somehow compliant with rules and regulation to allow these sections to be carried out. And therefore, the fact that these sections are not available everywhere with a large number of bodies started a kind of process that shifted a little bit how we teach human anatomy. Later on, in a few slides, I will describe for you what happens in Italy, which is a specific reality. But let's say we don't have a body to perform a dissection to understand anatomy. The alternative is your professor describing for you the human anatomy itself, relying on 2D images. On my slide, you can actually see some images that are back from the past, from Leonardo da Vinci. 2D images can be beautiful, can be oversimplified, or can have details so real that you are looking at a painting, as it is in this case on my slide. But it's not so easy when you use 2D images to understand three-dimensional features, the relations. You do not have a perception of depth, size. Therefore, it's an option. It is what was provided to me when I was a student, not exactly a few years ago, because I'm not quite young, but maybe it's not enough. And that's how virtual reality, virtual tools, AI might assist us in a shift of the paradigm of how we can teach human anatomy. Of course, every time we change something, we are scientists on top of being professors, we try to perform some research. So people in this field started to ask themselves if going from real dissections to virtual dissection was an option. And actually, the evidence, you can see an article I'm showing on my slide deck, is that if you bring into the picture also the option of technology, as we will see with very specific examples later on in my presentation, you can actually boost how students can understand and learn anatomy. There were studies in which they tried to compare, for example, if virtual reality, augmented reality, and artificial intelligence were able to evolve how we learn anatomy. And evidence is promising in showing that combining the different approaches is a good idea. And combining is possible when you have both options, real dissections and virtual dissections. We will see if and how it is possible, for example, in our country, in Italy, which is a specific case. Once again, we do like to measure the impact of our, let's say, approaches. And this is a very nice study, a randomized controlled trial, this time not on patients, as you might be used to, let's say, read about, but it was a study to compare the effectiveness and satisfaction comparing virtual and donor dissections. And after all, it was shown that the virtual dissection were fair options. Why I'm trying to, let's say, pinpoint the fact that in Italy, we have a specific environment in which maybe a little bit more of reasoning about virtual approaches was in place. You might not know, so there you are, the article showing that for you. But in Italy, there was not a law allowing people to donate their body to science up to 2020, so 6 years ago. That meant that no one was able to sign up a form and to express voluntarily the intent to donate the body to science. Therefore, body for deductive purposes were not an option. Of course, autopsies are performed in a hospital for clinical reasons, but the possibility of one person still alive to decide to donate the body to science was technically not possible. This is among the reasons why dissections were not widespread when I was a student to, let's say, train medical doctors in Italy. Now, at least the law is assisting us to think about this option, but provided that, specifically in our university, since we didn't have the option to go for the real dissection, virtual dissection became something we considered. There are several available technologies that can be purchased to perform virtual dissections. I put an elenchus on this slide to give you an idea of the possible tools you can exploit. This is not an exhaustive elenchus, it's just a representation of the main ones that provide you a platform which is made like a real dissection table, where instead of dissecting a cadaver, you have a screen to perform virtual dissection. I'm naming all of them, as you can see them on the slide. You have anatomist table, sector table, Pirogov, 3D Scientific, Cadavix, and Anatovis. All of them have their own specific features, and they do provide you with the option of a dissection that relies on digital technology, which is quite different compared to what is a natural real dissection, as we will see in a few slides. To reinforce that the shift from real dissection, when available and provided, to virtual dissection was appropriate, I picked for you, before showing our experience with virtual dissection, I selected for you some literature data showing how this possible new approach is actually consistent, robust, feasible, and impactful for the training of future healthcare professionals. But first things first, in this slide, you can find the information available on PubMed about the Visible Human project. If you want, you can scan the QR code I placed on my slide to have access to this same page. The Visible Human project was a very nice project to, let's say, kickstart the possibility of virtual dissections, because human bodies were acquired specifically to create a data set freely available that you can exploit as raw material to build up a three-dimensional virtual tool that is perfect for the virtual dissection. For example, the anatomy table that is mentioned in this literature paper is based mostly on data from both the Visible Human project and a similar project that was, let's say, based in Korea. The evidence of the use of this possible tool in anatomy education is that it's an option boosting knowledge and learning. But is this only for anatomy? Of course not. Similar evidence were shown for other of the options I've mentioned for you. So SECTRA, you can see one of the articles you can find in literature, stressing out how this virtual tool can be impactful and effective. The same goes for peer group. So we have several different tools. I will focus on anatomy table only because in our university, that's the tool that we have right now as an option for our students. But let's say that we would use this as an example for what digital tools for virtual dissection can do in general when embedded in a medical curriculum. So to go deeper into a discussion that somehow is linked to reality, let's start to understand how is the situation in our university. The School of Medicine and Surgery of the University of Milano-Bicocca is located in Monza, nearby the Fondazione San Gerardo dei Tintori Hospital, so pretty much nearby a clinical facility. And the medical campus is right there. And in that specific campus, we deliver the human anatomy teaching activities. We have several courses. We teach to pretty much all healthcare professional degrees, so not only medicine and surgery. Our head of the teaching staff is Professor Guido Cavaletti. As you can see in my slide, we range from medicine and surgery, nursing, midwifery, whatever healthcare professions you can think about. And in every degree, you have human anatomy as a subject that should be mastered by students. I will pinpoint right now medicine and surgery for a couple of reasons. As you can see on the slide, we have two different courses. One is the, let's say, Italian course, so taught in Italian language with 180 spots. And then we had another course, the international course, the School of Medicine and Surgery, which is delivered in English language, and the class is made of an international composition of students. In that case, the spots are only 50. I'm stressing this out, first of all, for the differences in numbers, but also because the two courses have different structures. Today, I'm focusing my attention for the examples that we need to discuss virtual tools on the English course, the international course where I teach. Since the class is made of just 50 students, we are able to accommodate them in the anatomy room I'm showing you in the next slide, and we were able to tailor the teaching, embedding in a proof of concept and feasibility phase, embedding them into the curriculum. Also because the international course has another specific characteristics that makes anatomy teaching quite peculiar. In general, human anatomy is taught at the start of your training as an healthcare professional, but for the international course, the approach is slightly different respect to what we do in general in Italy. Students receive a course which is named as Fundamentals of Human Anatomy during the first year. So they get a basic course on human anatomy, but then they will receive once again human anatomy teachings for the entire 6 years, which is the duration of our course. What does it mean? That we have what we call vertical tracks, in which you discuss one specific aspect of medicine, starting from anatomy and going up to the point you know how to treat the patient. I will give you an example for neuroscience. So there is the neuroscience vertical track. My students will see me once again. They saw me during the first year. They will see me once again in the fourth year. And we will have a very advanced neuroanatomy course. After I deliver my lecture, colleagues from physiology will reinforce in an advanced manner physiology. The same goes for pathology, diagnostics, semiotics. So you will build up track in which every teaching, even basic subject, is clinically oriented. Therefore, the link with clinical practice made the ideal, let's say, ground to test virtual tools, because as we will see, you need to revise very well anatomy, for example, in neurology, if you want to understand neuroimaging. So it was pretty convenient. On top of teaching undergrad students, we also have several residency training programs, and there, as I was discussing a few moments ago, it's even more important to embed virtual tools and to revise anatomy because there is a direct link with clinical practice. Let's see how it went, the story in our team, in our university for the implementation of virtual dissections. Actually, it coincided with a very specific time point. You see me in this photo in the anatomy room. I'm wearing a mask, so you might guess that we started this approach during COVID-19 pandemic. But I'm showing to you this photo to make clear to you how I deliver the actual lesson. You can see me using the table to perform the dissection, but over the wall, we have two high quality screens that are reproducing exactly what I'm doing on the table. So my 50 students sitting at their desk can see what I'm doing. But as I will discuss in a few minutes, I'm not just talking and showing things. I have a breakout session approach, and groups rotate and can come to the table to use this tool themselves to build up materials and to understand a little bit better anatomy. But as I mentioned, this started during COVID-19, and it was quite a good, let's say, option for me, because at that point we were relying on remote didactic activities. So it was not so easy to teach anatomy. Now, in this slide, I'm showing to you exactly what was embedded on the video that I posted on the e-learning while my students were at home on lockdown. That specific day, I was talking about the thorax and lungs, and thanks to the video that I created to the table, I was able to, let's say, download and then embed in my presentation. While I was recording the boring lesson, I was able to have a video in which I was describing one by one the most relevant features of the region of interest, not just delivering boring description and just talking to myself, but I was able to play with a 3D object, to show parts, to highlight with colors, making somehow an not so engaging approach, like, let's say, streaming delivery of teaching, a little bit more, let's say, able to keep the attention of the connected people up. You can see how the tool is flexible, and I was able to customize the visualization to the specific need of that specific lecture. Thankfully, the pandemic was over, and now we are relying on the virtual tool even more, of course, having students in the anatomy room and therefore making the interaction even more possible than it was during the pandemics. What I'm trying to do right now is to deliver the lesson, not just with the PowerPoint slide deck showing the 2D images that we said previously maybe are not ideal to convey some anatomical information. I prepare a slide deck that is not the slide deck, but it's a preset of the cadaver, and I discuss the topic while I modify the body, while I highlight structure. And I assure you that is pivotal because anatomy is describing shape, size, position, parts. If your mind is the mind of an artist, you read a paragraph and in your mind, a beautiful image will appear. My personal approach to reading and learning is more a semantic approach. So when I read something, my mind is not so keen to produce an image. Now I'm better at this kind of task because I'm used to exploit virtual tools. Therefore, for my students, I think it's important that apart from describing structures, I show them. And the lesson, how it is structured, changed according to the fact that we had this tool to be somehow exploited in our daily activities. What we do together is to split the activity into small chunks. Usually there is a first part where I try to deliver some information using the virtual dissection to highlight the most relevant piece of information. But then I divide the class into groups. As I mentioned before, I have only 50 students, so I can break the class into small groups, and I divide them over different tasks. One group will come at the table, and other groups will sit at their desk, and they will have different assignments. People at the table will do dissections with me, a guided dissection, will revise the topics, while people sitting at their desk will either exploit paper copy exercise, or we have let's say, a platform that is a companion of the table, anatomical lessons, where they can walk through a guided virtual dissection. And I have them rotate in order to have them come to the table and try to understand anatomy a little bit better. Moreover, as we will discuss in one of the next lectures we are having together for the METIS project, I also embed a gamification approach because there is a quiz mode you can, of course, exploit with any virtual tool that enables me to have each group competing to each other. So when we come up at the end of the course, I have a ranking and the group will win a prize or at least be elected as the winner of the entire course. But how we can deliver human anatomy teachings with virtual tools? Right here, I have selected for you one of the presets that I use for neuroanatomy. In this case, I was teaching about basal ganglia. So we are talking about gray matter, deep structures of the brain that are related to the basal ganglia system. And it's not easy to understand the shape, the size, and the position. And I assure you that it's not so easy to describe them just with words and 2D images. You can see while I talk about what I do during my lectures, how the 3D model, this one, is being played by me in order to modify, highlight, make visible some more information than a simple 2D image could ever do. Moreover, on the other side of the screen, as you can see where I'm putting the laser right now, you can also see the section of the cadaver, the photograph, the high quality photograph that was used to build up the 3D digital tool. I like that kind of visualization because these images, one slice, even if more information out there since it's not an MRI or a CT scan, which show you things in gray and not with colors. It's a nice way to train your eyes to learn how to better read neuroimages. So I try to combine this 3D object to make the point clearer about the specific topic that I'm describing that day, but also I exploit the fact that I have one slice of the cadaver on the other side related to the objects I'm describing to train the eye of my students for the day they will be required to read a CT scan or an MRI. But we are talking about digital cadavers. A cadaver in real life, it's pretty static, I would say. A digital object instead can become something else. Once it is a digital object, as you can see, I'm doing pretty much whatever I want. I slice, I cut, I color, I modify, and I change my visualization to adapt the structure to the needs of the description I'm delivering. For example, right now, still on the respiratory system, I'm showing the upper and lower respiratory tracts with fancy different colors to make everything visible. But what if, once my digital tool is a digital tool, I think about it in another perspective? Let's say, why not to animate the tool? Sorry, I will go back to the video. Oops, my apologies. Stuck. Sorry, 1 second. Sometimes technology can be our friend, sometimes even less. So I wanted to go real quick to this point. Once I have a 3D tool, since it's not a real person or a real cadaver, I can exploit the fact that we know about physiology and we can make this alive once again. And for example, these virtual tools to teach anatomy are now embedding something that is more like physiology. So in this case, as soon as I wrapped up the description of the upper and lower tracts of the respiratory system, I was able to exploit the physiology component of the virtual tool to discuss how the air can go in and out of my system to start reasoning on how we can perform a spirometry, which is a medical procedure, and also a bronchoscopy. So this is the visualization of the inside of the airways, and I can navigate similarly to what you could do in clinical practice while you are performing a procedure. So right now I'm pretty much simulating exactly pretty much what you see if you were to place a tube with a camera right down the trachea, reach the bifurcation, and enter one of the primary bronchi. And I think this is quite a huge leap. First of all, because the lesson is less boring, I can make quite clear why we are learning this piece of information to deliver one day a meaningful clinical action. And moreover, while I spend some time describing a procedure, so somehow engaging my students even more, I'm able to pinpoint some relevant information in order to hopefully have this information stored in the memory of my students for life. So it's pretty powerful to have this dual option, anatomy/physiology, to understand even better what we are trying to meet as a goal to train future healthcare professionals. But anatomy, sometimes it's not so straightforward. For example, to understand arterial vascularization of the brain, you require a little bit of, let's say, time to figure out where all the arteries are going and how they build up a loop that we name as Willis circle. One thing is to describe for you how this circuitry works. The other option is to have a schematic. So right now I'm pulling up my laser once again. This is a schematic representation of the blood vessel I would need to build up here the Willis circles. Right now I'm showing to you the aortic arch and the main branches that are in the neck area. And now I'm pushing the elements on the schematic drawing. And as soon as I touch the schematic, the blood vessel that is represented by the schematic will appear on my screen. I leave the vertebrae to give a localization in the neck for my students, and I go on as I have the Willis circle perfectly built up over there. Now I will skip a few of the frames. So I go up, and finally I'm able to close the loop, pun not intended. And finally, I have the representation of the Wheeler circle. And this way, I think it's the best option to describe a complex vascularization system from scratch, to once again try to make things clearer, and also to engage students up to the point that this description will stay with them potentially for life, because maybe you don't know it, but right now the Willis circle is something we can play with, so to speak. There is a procedure, the thrombectomy, that can be performed in case of an ischemic stroke. So let's say understanding of the anatomy of this specific vascular loop is important to deliver a successful clinical management. But once again, we can play with anatomy and physiology. This is the brain. Different areas with different colors are highlighting for you different functions. And I can show you that the different blood vessels of the Willis circus that I described previously are taking care of different parts of the brain. So in this case, the reddish part is the territory of the middle cerebral artery. It's easier to show them. Technically, it's reddish because now it's mirroring the fact that the stroke is there, so the artery is not working. The territory, the vascular territory of the anterior cerebral artery, instead is on the other side. So medial aspect would be the middle cerebral artery, and instead the anterior cerebral artery in the, lateral aspect for the middle cerebral and medial aspect for the anterior cerebral, where the blue color is pointing for you is the vascularization territory of the anterior, and on the other side, the middle. But one thing is to say this to you or to my students. Another approach is to deliver the description while I walk them through the dissection, and I can actually show which portion of the brain is affected and which portion of the brain is vascularized by specific blood vessel. Therefore, it's far easier to link anatomy knowledge and clinical practice. And the virtuous link between the two of them is the virtual tool. Moreover, since once again it's important that students are engaged, as I said before, the virtual tool enables to have the students do something during the lecture. In this case, I'm showing the video that one of the groups, while at the table, prepared. The task was, please, can you put some pins over the stomach, and then each pin is assigned a number, and each number would be showing a specific portion of the stomach. Now I'm running a little bit, okay, to the last frames. Now my students are still working. And at the final step, they put the pins, the numbers, and you have the tag. So they rotate and prepare. The last segment of the video can be exported and then uploaded to the e-learning system where I put the slide deck and the other materials. Therefore, even if the lesson is quite interactive, potentially they first act themselves to build up the visualization, and second, they will have some materials that are interactive, three-dimensional, and digital to be exploited even later on when they are at home or in the library studying. Another option that is given by the virtual tool is to make comparison. In this case, the tool we use also embeds animal virtual bodies. I picked the cat. For example, I use this visualization when I describe the locomotor system, and I want to pinpoint the fact that our lower limb is different respect to the hind limb of the cat. That's why the cat has an ability, if you think about jumping, that we do not have. So it's nice to reinforce something about human anatomy and to demonstrate that the anatomy mirrors function, showing that a different ability corresponds to a different skeletal framework. Another option that digital tools are providing us is to embed DICOM. I'm sure you know what DICOM is. It's the extension of the medical images. Virtual options for virtual dissections are usually, or some of them, provide you with DICOMs that are from embryos, so not real bodies. And DICOM, I mean MRI. In this case, I was going through the library of our tool that we have in our university, and I picked one specific stage, and I had a model of a specific stage of the embryo that was able to be dissected, as well as it is for the entire body, playing with some filters. If you had a course about embryology, you know how difficult it is to imagine the shape, the size, and the position of the different viscera throughout the whole development to show for real how the organs are at different stages. I think it's once again a powerful option, because understanding embryology is a good way to understand malformations if we stay on the topic of macroscopic anatomy, for example. Another option that I would like to discuss with you is how to fully, let's say, exploit a digital tool as a table that you have in an anatomy room. As I mentioned before, when I deliver teachings for the English international course, 50 students there, I am in the anatomy room, and I have enough room there to have them sit and, let's say, enjoy potentially the lesson. But it's a digital tool. So a digital tool can be operated remotely. In our rooms for teaching, we have a podium, as you can see, that is connected to a projector. So in this room, for example, I can fit up to 120 students, if I'm not wrong. And I can operate the table remotely via the podium. This is like a tablet or a laptop. So right there, you can see the photo of the same screen that is shown here. This is the table showing you the pregnancy simulation. And I've also taken a video to show you that even if operated remotely, it does cooperate with you. So you potentially could deliver your lesson, not in the anatomy room, but being at the podium and doing the dissection live once again to describe topics while delivering a 3D visualization of whatever you are describing. Last but not least, the table embeds DICOMs, so once again, radiological images from real clinical cases. This is a case already present in the data set when you purchase the tool. So it's not my case, so it's a case you can find freely inside the tool itself. And here you can see how you can perform a discussion. In this case, I was first looking at this side of the screen. This is the image of this patient, the real medical image. And this is the 3D object that the table is able to build as soon as you upload the data with this photorealistic filter. So in this case, there was a mass that was relevant for the discussion that day. And I played with the filters, with the 3D object to deliver some meaningful content for my students. Technically, in that case, they were not undergrad, they were residents, because as I mentioned before, as I mentioned before, we teach to residents and not only undergrad students. Another option you might have when you go for virtual tools and digital application in human anatomy is to embed clinical cases into your teaching, because these are actual medical images of one specific case, but in your clinical practice, as it is in mine, I'm a neurologist, I might encounter clinical cases that will be matching CT scan and MRI. Potentially, all the DICOMs that you put in a platform such as this can have the same behavior. So you have the CT scan or the MRI, it is in this case, and it can become, in one moment, a 3D object that you can use for deductive purposes. And I assure you that is quite powerful in enhancing the understanding of the clinical anatomy correlates. One of the last, let's say, implementation that we had in our university, speaking of virtual dissection, human anatomy, and teachings, was related to a project funded by the EU, the ALMA Digital Education Hub. Pretty much, we did what I'm doing for you right now, even if a little bit more, let's say, in an engaging way. We recorded some videos of me at the table that are posted in our digital education app. And now we made this open source. For example, if you care to have a look at it, it's in Italian language. I apologize, but it's meant for our university students, Italian course, or in general for Italian university. Inside there is a course in which you have videos of dissection with the teacher at the table doing the dissection, giving to you information, and then you have some interactive gamification approach to consolidate the information that were delivered. And pretty much this is what we do in our university to boost the possibility of learning human anatomy, exploiting digital tools, something that for us was even more pivotal because, as I said at the start of this conversation, we do not have virtual dissection as an alternate option respect to real dissection. Pretty much it's only virtual dissection or the 2D attacks and the textbooks. Of course, there are 3D plastic models, but not having real bodies, we were pushed into embed virtual dissection even more.